Good afternoon, everyone. Welcome to NORDIC Health 4.0 the Amplifiedness. Today we have two companies sharing today. My name is Nika from Innovation Norway, and earlier we have heard from Selenion. And now we are this session is for Predicell. And for tomorrow, we have three more companies coming online. We have 3 p.m. Nichat, 4 p.m. Alto, and 5 p.m. Escom. So the presentation structure will be as before, 30 minutes of presentation and demonstration, followed by 15 minutes of Q&A. So presentation has started since the 7th of June and will end on the 15th of June. There's a total of 17 companies presenting. Please join us by registration on the link. It's free. If you are unable to attend, please still sign online because we will then have recorded session which we can send to you. And if there are any other challenges which you are facing are not covered in this presentation, please contact me. Here's my contact information, Nika from Innovation Norway, and my email, and we'll be on a constant lookout for the solution for you. So a total of 17 companies are in these sharing sessions. These are the first 8. And these are the remaining companies. So today we have Akib from Predicell joining us. He'll be sharing the solution with us. So let me just stop sharing and then Akib can take over. Okay, Akib, the time is yours.
Right, thank you, and good afternoon to Singapore and good morning for the people in the Nordics. My name is Aki Kuivalainen and I'm a founder and CEO of the Predicell company. Predicell works to activate my health data for patients and or individual persons in the rehabilitation processes in the medical rehabilitation and physical rehabilitation best. So let's utilize the data, what each of us as an individual could collect and allow sharing to improve care processes and efficiency in that sense. And that's what Predicell is. I will now stop sharing my video and start sharing my screen. Yeah, thank you. And sorry for those hassle for a bit. But yeah, for Singaporean market, and we have actually built together already a partnerships with the local IOTA MedTech. And together we have come up with the concept called PopuCare, which I will walk through. But actually, PopuCare is answering for the challenge or demand, how care could be delivered and supported beyond hospital walls. And there is for example, a InnoMatch competition ongoing on their market, and is our solution for that competition as well. But just want to highlight that Predicell has local partnerships and local implementation and support already available for Singaporean market by our beloved partner IOTA MedTech. Yeah. First of all, the challenge, the problem itself, we have learned that 1 in 4 Singaporeans aged 40 and above, they have at least one chronic disease, and that will have a major cost challenge for the society, and something needs to be done for that challenge. And that's because adoption of unhealthy lifestyles has contributed to more chronic diseases and will increase, as I guess we all know within this call, since you are from the local market, most likely. And also we have evaluated that and researched that spending on the healthcare itself has tripled from 3.7 billion Singapore dollars in 2010 up to 1130 billion by 2019. So the cost of healthcare has really grown up, rocketed, and typically the cost drivers are chronic diseases, care, and kind of holding up a solution and system or a whole system for the healthcare. And we would like to see more investments done to the prevention or secondary prevention side, and that's where Predicell would help the best. And also since we are looking for the opportunities, how the care could be delivered beyond the hospital walls, we have found out that there is lack of home-based and preventive monitoring of vital signs for identified patients. There are one shop window type of the solutions on your market we know very well, but the Predicell is actually collecting data from these different, and this PopuCare is collecting data from different data manufacturers and data sources devices. So we can then provide a one end user experience for the care professionals from day one regarding the My Health data collection and data analytics and visualization. But that's the problem side. And Predicell has delivered its solution here in Finland and Nordics partly. In Sweden, we have some minor projects as well. And we have followed up carefully the actual impact for the care delivery organization once they are turning to use Predicell solution and this PopuCare solution from the concept-wise we are talking to Singaporean market. And we have found actually that there will be minus 40 less unnecessary visits at emergency, and I can later on explain why that happens. And at the same time, minus 11 percentages less primary level doctor appointments. And both of these actually comes from the fact that once patients are monitored by themselves, let's say wearable or smart blood pressure regarding the care chain and care path they are joining and to be taken about care, they get committed and they gain trust. They can rely and trust on the fact that once they are delivering their data, someone on the care organization and care delivery side would rather immediately know and find out that something to be intervened might happen and will occur. And that actually releases stress and kind of a demand to visit on the emergency, for example, just for the checkups. And same change is also regarding these primary level doctor appointments. But I would like to highlight from these doctor appointments and doctor visits on the primary level, the solution will also notify and make visible some care gaps, which means in practice that for some individuals who might have some symptoms or challenges on their care, but they haven't yet visited or haven't yet taken care or contacted the care organizations, they will come visible, and by that then new appointments and some new visits and checkups will be done. But the majority actually will be regarding the less demand for the visits of the doctor, and doctors and nurses work will change more on the coaching type of the counselor type of the role. And at the same time, which we are very happy and proud is that especially when we are talking about the care delivered beyond the hospital walls in regards to care homes or home care, the nurses and those care professionals working on that segment, they have reported to us once we have carefully followed up and researched on our deliveries that actually even 50% from the appointment times, visit time at home can be added as an efficiency improvements, and it's definitely under the care organization's own decision. Neither they would like to give more quality care time for the patient, or they could then increase the amount of patients served by one nurse. And that's not on the Predicell side decision or PopuCare decision. It's on the care organization decision, definitely how to use the resources on the best way. And also, once utilizing that My Health data for the rehabilitation process best, we have found out in our project that even 50% more efficient rehabilitation processes could be achieved compared to traditional way, that not using and utilizing this kind of remote monitoring and My Health data collection for the rehabilitation process best. And here on this slide, we are sharing care paths we are supporting now with our platform at the moment, what type of the patients we have, and patient's background in the rehabilitation. So we can monitor and follow up heart failure patients, and neither they are taking care on the cardio or chronic clinic. And definitely the benefit is that the ER visits will decrease quite enormously once they are monitored on remote. And this physical rehabilitation or lifestyle guidance or counseling, it depends how the organizations nominate that process or that area, specialty area, can easily be supported. And actually we are supporting quite a lot at the moment here in Finland for this kind of interventions. Type 2 diabetics, whenever it is chronic diseases, risk measuring and risk-based chronic diseases, we can support on those care paths. And from which we are very proud is this stroke rehabilitation. We have built up a holistic solution for both patients and the rehabilitation process professionals. And on that area, we have been able to catch even that 50% more efficient rehabilitation process time-wise. Once the traditional estimate was that the process will take 4 months, and in practice that ended in the situation that this individual was able to walk and be an active member of the society after 2 months. But here we need to notify and understand that individual changes quite a lot on the rehabilitation side. And also one of the foreheads on the PopuCare solution and deliveries we are building up for the Singaporean market is this sleep apnea and sleep disorder clinics or path support. We have about to start a project to validate our sleep apnea detector tool for your market there in Singapore, and it will happen on autumn. Those are the main care paths. And from the solution readiness perspective, we are on TRL 7 level, which means that we have all bits and pieces for the development. Definitely we will do, but we are ready to start the deliveries. And as I said, we are already delivering here in Finland, has been doing that for 2 years already. Within the totally more than 500 episodes supported by our platform. And as an outcome, we would like to see a test or pilot processes from which as an outcome we could get a fully tested platform to assist clinicians and make supporting the healthcare decision side. So that's our situation here from the TRL perspective. So ready for test bedding or piloting within your market. And in this presentation, I have some pictures which I can share afterwards together with you from the user interfaces, but we'll go more thoroughly on the demo side. But this you will have these slides. And then turning to demo. Or if there are any questions or comments at this point, I can take those at the moment. I can't hear anything, so I guess that there's no, but please interrupt at any time. And just checking, since I changed application, is this screen sharing still okay for you? I realize that it is okay. Okay, thanks. Well, now it's the time for the demo. And here I am typed in the Predicell platform as a care professional. I could be a doctor, clinician, I could be physiotherapist, I could be nurse, practical nurse, I could be a coach as well. And I can see those patients who are actively delivering data and sourcing data for the analytics in our responsibility area. And here we can see blinking alert. We can easily notify the care professionals that who are those patients that should have immediately actions or at least look after more carefully and quicker. And just selecting the patient, we will get on the general information view. And here we can see the parametrics, what we are providing from these individual patients. And these varies based by case, when whatever is relevant from the patient's point of view, that type of the data we should source and collect. So in practice, let's say on the blood pressure clinic, it might be a good idea just to follow up blood pressure metrics. And let's say that, and maybe also heart rate from the wearables. But when people are purely on the rehabilitation side or sleep clinics, it could be idea to follow basically on sleep, or from the holistical point of view, each of these parameters could be followed up. And here in the user interface, our default view is actually follow up 7 days constantly backwards, starting from the actual date. And here we have a calendar functionality from which care professional could then change the view. Let's say for some sort of the summary, I would like to look after last month's May's activities and data from this person, so I can do it. And we draw the graphs view on the user interface, and when you change your mouse over the bullet, you can see what are the actual numbers of each of parameters. Also for the energy consumption. And in additional to this type of the data visualization, we have also developed a PDF print tool, and this is way how care organization actually communicate mostly in our delivery to the patient side. They will print out or discuss over the laptop or whatever, and they are using as a technical background. They take this report out and have that kind of a feedback discussion with the patient. And they also save this documentation on the EHR under the files of the these particular patients. So we don't at the moment have a direct integration to the EHRs, but our customers who are using our platform, they prints out the PDF and saves that in the patient's documentation under the EHR. So that kind of a manual integration we do have. And in top of that, we have also generated a table view, and this collects and visualized all the data which are on the graphs, also for the table mode. And that applies all the activity and metrics, and we have divided the sleep cycle visualization on the separate view. And for data exporting, we have also this CSV downloading, so every and each data could be printed out or downloaded on Excel as a CSV file, and after that, organizations are capable to add also on this data some other, let's say, appointment times or some other financial related info and data together to better understand how the money goes based on the care operations. But we will have that individual patient data here coming from the wearables or smart devices. I can see that there is a question in the chat. Good question. A full range of vital signs that can be measured. At the moment, we are measuring blood pressure, systolic, diastolic, heart rates, daily activity steps, energy consumed. On the sleep side, I can actually more effectively show you from another patient who have a bed sensor in use for the demo purposes. Let's take the sleep metrics here and take the readings sensor data. So from the sleep side, we can then distribute the sleep cycles on this way, that what are the sleep levels and how much has been awake during the sleep night, and also the heart rate variables. And in addition to that, respiratory event index, which is our way to detect sleep apnea. And these are the typical metrics or parameters we are following up. Then we have also, by the COVID-19 support, we have added this body temperature follow-up and monitoring, but it all depends if individual this patient have those smart devices in his or her use to get data. And in addition to that, automatically data sourcing, we have also built up a manual entry possibility to the platform, which means that it happens that the patients comes to the appointments and something relevant data comes up on the appointment, which we are, examining. And here on the Predicell platform user interface, care professionals could also add some metrics manually, and they will end up on the data visualization. So we have both words in our hands, the sensor-based data follow-up and collection, but the manual entries as well to support the home monitoring or remote monitoring and appointment-based metrics and monitoring. And I would change once again the patients, and we'll go through down the user interface. And as you can see, we are browser-based solution here. But I go there on the downwards, and here we have a sensor management area or tool from which we are able to see at any time which device should be found from which customer or patient. And here under the sensor management, we have information regarding the last session date, the energy level of the device, and so on. Every now and then, especially on the home care side, it might happen that the elderly don't remember to, charge the device, and care professional could easily see from this user interface that should the device be charged or batteries to be changed, and could be contacted, or could be then telling to the colleague who are visiting at the home care, for example, that please have a look over the smart scale, for example. It seems that the batteries should be changed or device should be charged. And here you can see currently supported data sources based on the sensoring. We have full support for the Withings product family devices, covering also the newest smartwatch as well, device which could produce the EKG samples as well, 30-second samples. That we have in a database, and data is collected, but we are not showing yet on the user interface the ECG information, but that can be also added as a data source. Then we have support for Garmin, but in this particular patient, we don't have any Garmin entries, and MFIT sleep sensors also for sleep clinics and sleep analysis. Yes. And back to upper side, we do have also here a method to add so-called partner apps in our words. And by this, we mean that if organizations have some sort of the own developed or third party, from our point of view, third party patient application in use or patient portal, we have a logic here in the platform that we could add that solution as an external or partner application to provide data and for the data exchange between our platform and with the third party patient portal or patient application. And our logic is to create this secure ID, 6 digits, and give that for the partner apps. And by that, then the keys are changed, and so far, and the integration is valid. It's not removed or deleted. The data exchange will work from the Predicell platform point of view. And here I will give you one example from the solution we have from the partner apps as well. We have built a integration with one of the rehabilitation patient app called Kuntoudu app, Rehabilite Yourself app in English, where the end user organizations, they are using this WODAS forms, World Health Organization Daily Activity Schedule, and that is typed and worked on the patient app. And once the patient herself has answered on the application or on the portal side to the questionnaire immediately after saving and submitting answers, and that data is visible also for the rehabilitation professionals. And here we can see all the answers, but also the development of the scoring. And you can see all the entries for the care professional rehabilitation process. In practice, typically these daily activity assessment questionnaires are conducted in the beginning of the process, in between, and in the later or ending part of the process. So we do have typically a 3 sets of answers regarding this daily activity schedule or any other assessment type of the data entries regarding the rehabilitation process. And here I can also share to you that we have a so-called self-service integration logic built here, that care professionals, by the consent of the end user, can then create those integrations based on the user account for Withings, Garmin, or partner apps solutions as a self-service principle. So we don't have any lack of time to build up these integrations. Everything could go smoothly from the care delivery organization's side and point of view. And definitely when starting and delivering projects, we will train and educate and support in the implementation phase, and also once we are working on a longer term. And typically, from the project perspective, we would like to reserve 4 weeks equals 1 month working time for the implementation project, and would be happy if receiving party or organization could nominate sort of the project manager or care coordinator for the project, implement Predicell or platform in the implementation project. And approximately the workload will be somewhere quite close 20%, so 1 working day per week in a total. So the implementation phase and implementation projects are quite light ones in that sense. So that was Predicell platform, remote monitoring, smart remote monitoring platform in a nutshell. Functionalities, looked over what it is for the care and rehabilitation professionals. Now I'm open for any questions or discussion.
Hello. Hi, can I ask, does it mean that the patients will be given a Garmin wearable? Because I saw a Garmin tab in your data sources just now.
It depends if the patient or this individual has already her own devices, which are, let's say, Withings or Garmin or MFit or our already supporting devices. Definitely we can use those as our own. But typically in our deliveries and projects here in the Nordics, care organizations like municipalities or also private ones, they acquire or buy devices from our end. We deliver those and then they are given for the end user for the process until the intervention is ongoing. But we can see in the coming future as the wearable devices and the usage will grow, even though quite extensively, the my own device type of the data sourcing will come more active. But as I said, typically they are delivered from the care organization in our projects so far.
I see. But currently, what are the types of wearables that are supported?
From the device perspective, we are supporting smartwatches and whole scale from the Withings, smart scales, typically body plus smart scale from the Withings, since it has a body composition information as well, and all the smart blood pressure monitors from Withings as well. And from Garmin, actually the full scale of the Garmin products can be supported because they are delivering data from one API in the interface, and same applies for the Withings as well. But we have hand selected those devices which are clinically validated, and by that then could be used to support healthcare processes.
I see. So it's not only Withings products lah. So other brands or models might be able to integrate into this solution as well.
Exactly. We have a open API and in and out APIs in our architecture, so we can include new integrations as well whenever it is relevant for the patient and for the care organization. And by that I mean that, for example, blood sugar, blood glucose metric tools, they vary quite a lot based on the markets, but we can start to support those as well as an additional integration.
I see. Okay. And one last thing, is this currently supported on both iOS and Android?
The platform itself, it is a browser-based solution. So in that sense, once you are using Android or iOS as a end-user device, the both are supported because we have decided to select a browser-based architecture. We don't have, from the platform itself, we don't have native apps available. It's all web services. But for the end user, then once he or she is dealing with the data sourcing using those devices from the device manufacturers, they do have support both iOS and Android applications.
Okay, and also in terms of the costing structure, right? Will hospitals be given a choice to just buy the platform only, or would there be an option to actually purchase both the platform and the wearables? Because I think some patients may not have wearables or like any monitoring devices at home.
We have created a business model where actually both words apply. Organization, hospital, for example, they could order and buy devices from our channel as well. We can deliver those and take care of those, or they can, if they have sourcing channels on their own, they could also buy them from their own channels and sources. And from the other end, then definitely we could support deliver purely the platform itself without devices, if the customer case is so. But typically, as I said, we have combined the device delivers with the platform delivers.
Okay, Ken, thank you so much.
Thank you. My pleasure.
Can I just check, is it a subscription model for the platform?
Yeah, the platform business model is subscription-based, so that we invoice based on the patient's sourcing data for the analytics per month per organization. So and the invoicing is based on the 1 month beyond or behind. So in practice, as an example, we will prepare our June's invoicing in beginning of the July. But based on the amount of patients sourcing and delivering data for the analytics. And professionals don't have any costs for the license costs or any other costs.
So for the current business model, do you bill the patients or do you bill the providers?
Sorry, could you please repeat?
For the current business model, who pays the bill? Who pays the subscription? Is it the patient or is it like healthcare organization?
Yeah, healthcare organization based our bill. But they do have here in Nordics, we have cases where the care organization, let's say municipality or region, they have their own patients payment rules and principles, and they at some occasions they have added this platform support in those rules and principles, so they can have that what it is patient invoice, but they are doing from the municipality or region organization point of view, that, and we will invoice the care organization itself.
Okay, thank you.
My pleasure. And just a short comment regarding the cost structure side. Definitely, we will have some costs for the implementation project, and that those will be invoiced based on the workman days once entering on that level. But the platform itself is monthly subscription-based model. do we have any other questions or comments or regards?
So, Aki, I have a question. You mentioned that we do have a Singapore partner, IOTA, right? So has IOTA started any trials or have any customers in Singapore already?
Now I need to be very careful about that, how I answer on that question. We do have good potentials and deep discussions. We are in practice preparing project plans for the 2 organizations. But since we haven't signed those agreements yet, I couldn't share who they are. But we do have deep and direct activities on your market at the moment.
So for support-wise, IOTA will be supporting for the Singapore customers, right?
Yes. They do have they do have a full rights to present Predicell on your market, and they will be implementation partner and also the first tier customer support level partner for us and for your professionals and organizations.
Thank you. Do you have any more questions from the floor? Okay, if not, we'll end the Q&A session here, but not to worry. You have further questions or you want to see more of the demo or get more information, then you can actually contact me. Here's my email. Then I'll link you up with Aki and also the Business Finland team so that they can follow up on your inquiry. And if you come in slightly late and you missed the earlier part of Aki's presentation, you can also email to me. I can forward the recordings, which will be on YouTube to you so they can watch the full sessions. So that's all for presentation today. Tomorrow we have 3 companies presenting, Nichat, Auto, and Eskom. So we thank you, Aki, for his presentation, and have a nice day.
My pleasure.
Everyone. Thank you.
Thank you. Have a nice day. Bye-bye.
Thank you.